Okay, thank you.
Hello.
Hello.
How are we doing today?
Pretty good.
Excellent. So, since I saw you last, we got a bunch of labs. We also got CT of the neck. Just if we could find some other cause for, your head dropping down like this.
Yeah.
So we were looking for different types of myopathies, other lab abnormalities. Essentially, all that looked pretty normal. You had a little bit of elevation of a substance called BUN, which can be a measure of like how the kidneys work, but it was pretty minimally elevated. We also, I think it was also chloride was like 1 point higher than normal, but otherwise everything else was pretty darn normal. You were also, you're having issues with bowel and bladder also, is that correct?
Yeah.
Okay. So with some of your, balance, the slow movements, how your head's dropping down, I wanted to look at your cervical spine to see if you had maybe some narrowing that was pinching down on stuff up there. That can affect bowel and bladder stuff also. But we did not see any of that.
Okay.
You have arthritis up there, just like everybody who's 77 will have, right? But there wasn't anything that was pushing back really far, anything that we thought, oh gosh, yeah, that's pinching down on our spinal cord, because we don't want to do this Botox, if it's because of the narrowing in the spine. That's not necessarily gonna change the outcome. So what we've talked about is you have tight sternocleidomastoid muscles up here that are pulling you down, and then also your scalene muscles are pretty tight in the front also. So what Botox does is it weakens those muscles. We understand that you're weak back here, but we're going to weaken the ones in the front to help you hold that head up a little bit better is the goal. Anytime we use, anytime we coat a needle to the skin, there's risks of that, right? So we have risk of infection, bleed, nerve injury. The Botox itself, it weakens muscles, right? So we're going to be injecting around the neck. I use guidance with either EMG or E-stim, and that helps me localize the muscles that I'm targeting. Excuse me. There is, that helps us reduce those risks of nerve injury, of bleed. I make sure that I'm looking at the anatomy as far as where I'm poking, and then that the localization with the E-stim or the EMG helps us to minimize the risk that we get that in a muscle that we don't want to get it in. Fair?
How bad did it hurt?
It doesn't hurt me at all.
I know it ain't gonna hurt you.
Yeah, people tolerate this at different levels. I mean, some people, they really don't like it. I'm poking you with the needle, and then I'm using that needle to cause your muscles to jump. So there is some discomfort with that.
How long does it last?
The discomfort or the treatment?
The treatment.
The treatment can last, so I'll say it this way. We can repeat that every 90 days, okay? One other thing I forgot to mention as far as the risk. We're close up to where these muscles are that help you swallow, okay? So there's always a risk that that medication moves a little bit and can affect the swallowing also. That's why we use these localizations to minimize that risk, but it is a risk.
Is that a pretty low risk, or
I cannot give you an exact percentage.
Sure.
I will tell you that I have not had that happen, but that is a theoretical risk of using this.
Yeah, mom's a worst case scenario.
Yeah.
So we like to
I
comfort her
have a
if
special
possible.
I have a special on those people sometimes. Like, well, if this wasn't supposed to happen, it did. This wasn't supposed to happen, it did. This was, and then I'm just like, oh geez, do I even want to try anything? We can repeat it every 90 days, but there's some people that it lasts longer. There's some people that it doesn't last as long. The medication, like I said, we use Botox, or that's the plan. We'll get the SCMs and the scalene muscles. Those are both pulling you forward. what we would be looking for is the ability to help raise that head up a little bit more. Okay, so it's not so dang tight pulling you down. Though the effects of that medication can happen in as little as 3 days, people can see a benefit. That's kind of what the data shows. There's some people who say, boy, when I walked out of there, I felt better, you know, so whether that's a little bit placebo or who knows.
Yeah.
But then about 2 weeks, we see about the optimal effect of that. Sometimes it takes 2 injection, times before we see kind of the full effect of how that will be. I'm a pretty conservative guy on how I do things, so we usually start a little bit lower in the amount, because there's always a risk that I make it too weak also, so I usually use small amounts, and then we can always put more in later. That effect of the medication wears off usually around that 90 days. Usually, I say that, I have other patients that have different things that you have going on. They have cerebral palsy, so they have tightness and spasticity in other areas of their body. I have one lady that I do about every 6 months. Like, hers seems to last longer for whatever reason. So we'll kind of tailor it to what you have going on.
Okay.
So now that I fire hosed you with information, what questions do you have?
Where at in my neck do you shoot?
Yep. Can I scooch you out here?
Yep.
So we're it up. So we have this muscle right here. This muscle right here, your sternocleidomastoid, and then your scalenes in here. Scalenes in here. Can I have you come over and sit on the table here? How long have you had your head drop again?
It's been dropping for a long time.
Long time.
I'd say like in the last year and a half. I have birthday pictures of her 2 years ago, and it was significantly more last year. So, she was pretty much
Can I look at your
close
back?
to normal.
Mhm.
Have you lost a lot of weight recently?
Lost over 100 pounds in
Yeah.
the last year and a half, 2 years.
Closer to 4 years, last 3 or 4 years, Mom.
And they've worked you up for all sorts of other things.
Yeah, she had some lifestyle changes.
Okay.
That she moved to a new place. There was more walking involved at that place and less food, outside food.
Weird, huh?
Yeah.
Food makes a difference on your weight.
I've got food. I'm eating better because I have a meal cooked
Yeah, that's awesome.
midday. So I don't have as much weakness as I had before.
Okay.
Yeah, she's definitely she's in a better situation now too, so.
Does that hurt when you put your neck back like that?
It's just hard to do it.
Because it feels kind of stuck in the front.
Well,
Pull this down. Yeah, so feel the tightness of these muscles here. Is that hurting?
no.
Yeah, those SCMs are so sticky. Both sides. You know what? I talked about the scalenes also. I think it's mostly your sternocleidomastoid muscles that are pulling the sucker down. Are you hurting there?
It doesn't
You're feeling it mostly up in here?
in my back.
Your back? You're not supposed to feel it in your back. You can bend these knees. Is that a little better?
That's
little better.
Okay.
Mm-hmm.
No difficulty with swallowing now?
No,
No? Okay.
sometimes it's my pills, but that's
Cause
Yeah,
they're
you always kinda
huge.
had that, because they're huge, yeah.
tablets, the capsules I can take without no problem, but the, tablets, just, I don't, they stick in my mouth.
Okay. So it's more they get stuck in the mouth, not necessarily going down the,
Yeah,
okay. Okay. Hmm. Well, you wanna give it a shot? Pun intended.
I guess so,
Okay.
yeah,
It's kinda silly of you to wear a turtleneck today.
I know,
What were you thinking? Are you okay laying right here?
yeah.
Okay.